If you have a knee replacement, there are two things that you need to watch out for while getting older. Because when getting older, two phenomena occur that will negatively affect your knee prosthesis. One is stress shielding, the other one is sarcopenia. I explain. Number one, stress shielding. While getting older, the natural strength of your bones decreases. You can actually see this on a radiograph because the bone becomes more transparent while getting older. We call that osteopenia, or in the severe stages, osteoporosis. So that is kind of a natural evolution. And it is one of the reasons why you need to keep on walking and being active while getting older, so that your bones get loaded and stay strong. Otherwise, when you fall, you may easily break your hip or your wrist. Now, what is important is that while getting older, the bone gets weaker, especially around your knee prosthesis. And the reason is your knee prosthesis itself, because the knee prosthesis itself already unloads the bone. So if you reduce activity while getting older, the bone that supports the prosthesis weakens quite a lot. And as a matter of fact, at a certain point, the supporting bone becomes so weak that you will start to feel pain when you load your knee. This phenomenon we call stress shielding. In the normal knee, without a prosthesis, the loads during walking and standing are nicely transferred through the bones and through the knee, so that everything stays strong. But in a knee prosthesis, the load transfer gets shielded by the strong metal components. Therefore, the bone under the prosthesis becomes weaker. It is shielded by the prosthesis, and therefore loses strength because it is no longer loaded enough. You can sometimes see this when your doctor asks for a technetium scan, like in the person here, where you see the darker tracer signal around the prosthesis. That is indicative of stress shielding. And you need to be somewhat careful about this, because in some cases, the bone may actually even become so weak that it not only causes pain when you are active, but also that it becomes so weak that it is no longer capable to sufficiently hold your prosthesis, and that this may gradually become microscopically loose. So the message is, while getting older, you really need to stay active and load your knee by walking, standing, and being active, so that the supporting bone stays strong, preventing your knee from becoming painful. And combine this with sufficient calcium intake together with vitamin D, because vitamin D pumps the calcium into your bones and makes the bones stronger. Your doctor can easily check whether you are low on vitamin D by taking a blood sample. 25-hydroxyvitamin D should be above 30 nanograms per milliliter, or above 75 nanomoles per liter if it is expressed in nanomoles per liter. If you are below that, you should take vitamin D supplements and sufficient calcium, either with your diet or using calcium supplements. 1200 milligrams per day is the minimum overall calcium intake that you need. Sometimes even stronger medication may become necessary. We call these bisphosphonates, which are also used for general bone demineralization, like in osteoporosis. The second thing that happens when you get older is that you lose muscle mass, and this we call sarcopenia. Automatically, it is almost inevitable. It just happens while you get older. And just like losing bone mass, sarcopenia will negatively affect your knee replacement. For two reasons. Because the muscles around your knee, like around any other joint, provide you strength and stability. So if you lose muscle mass, your knee will become weaker and more wobbly, and therefore also more painful. Secondly, your muscles are important for shock absorption, because they function like springs around your knee that absorb the impacts during walking or when coming down the stairs. So it is important that while you get older, you keep the muscles around your knee strong and functional, because they protect your knee replacement from being painful and unstable. That is the second reason why you need to stay active. Here you see some examples on how you can do that. And if this is new to you, you may want to have a look at this video, where I show you how to do the most basic exercise to start with on a daily basis. Thank you for watching.